Good morning, Uganda. Thank you so much for joining us this Friday morning. My name is Julie F. Nantaba. And as always, Friday is light, but we keep the goal on inspiring Uganda. UBC TV it is, and we come to you live from Nile Avenue. Now, earlier on, we were having a conversation on domestic violence. And allow me read a comment that came in a little late right after we went into a short break. And it reads, and I hope when whoever is watching and is responsible in a place of leadership or can play a role in rectifying this can indeed rectify it for a better name, all right? Pentecostal churches are promoting domestic violence. My wife joined her organization's founding church, and before long she was having extramarital affairs with a pastor who also doubled as their director. And this is not an isolated case. This is Martin from Agago. I'm sorry, Martin, this really happened. But indeed, it shouldn't be the brand of the Lord who created you. This is not right, indeed. I hope there are in parties that are responsible change the narrative of things such as this. But in the 16 days of speaking into gender-based violence, we say no to gender-based violence. You do not beat a fellow adult. You do not abuse a fellow adult. It's two partners coming together to change and make the world a better place. And if you feel that the vision has been lost, as opposed to killing each other, take some time away and heal and find ways of amicably healing, emotional healing and everything healing to have a better future for Uganda. Now, the conversation we are supposed to be having, indeed one that we are engaging in right now, is matters health. And we are going to look at empowering the health sector of Uganda. 0709-602-592 is the WhatsApp number that you should save and engage in this conversation. We're going to look at quite a lot of areas in regards to health, but most importantly, matters being cared for while you are sick, especially not just sick, but pregnant, expecting mothers, mothers who are delivering their babies and bringing forth life into this world, anyone who's sick and needs extra care. Many a times it is known that, but from experience, that public hospitals usually have rude healthcare assistants, from nurses, doctors, maybe midwives. It's usually, that's the narrative most times, that people in public, healthcare givers in public spaces are usually rude. And instead of aiding the healing process of this patient, sometimes it will worsen because of that emotional torture. But we're delving into all of that detail with solutions. Now, in studio with me is Dr. Brenda Namisango Shatuk, and she is the president of Tebajukira Health and Empowerment Center. And the focus of conversation is empowering the health sector. 0709-602-592. Good morning, Dr. Namisango.
Good morning.
It's a pleasure having you this morning.
Yes, me as well.
And because health affects all of us, what better way to inspire the nation with solutions and a conversation that brings light from your perspective?
Yeah.
Indeed.
Thank you. So my name, yes, is Dr. Brenda Namisango Shadak, founder and the president of Tebajukira Health and Empowerment Network, with the headquarters in Nkuke, Nalozari, Masaka. I'm based in U.S.
Okay.
And my role in U.S., I am the Director of Nursing Services for the Department of Corrections. So I oversee all incarcerated people in the whole state, making sure that they have the care they need, regardless of what their background is. But I'm also associate professor at Vermont State University,
right.
Teaching young nurses, professionals, to make sure that we are producing the best qualified professionals that we could have.
When you use the word professionals, what exactly does it mean to be a professional nurse, a professional doctor, a professional healthcare giver? Aside from having the knowledge and expertise, give us a breadth of what that looks like.
professional, to me, it means the way you carry yourself, the way you treat people. So when people come to us as providers, they are very vulnerable. They come to us, they feel that we are gonna give them hope. So for me, as a professional person, I'm there to listen to their story and also empathize with them. Give them hope that we're gonna do what we can to help you. And it's not only the patient, right? So we encompass the whole family. Because if I come in sick, my family might be affected. So as a professional, I am going to treat the family member the way I would treat the patient. Because that's how I express how I may not be in their shoes, but I'm also empathizing with what they are.
Empathizing,
right.
that's very profound.
Right, and also
yes,
being inclusive, culturally sensitive. We live in a world where we take care of people with so many different backgrounds. So for us as professionals, we have to be culturally sensitive so we do not have biases in what we do.
Right. And does that, in a sense, make you partly bring you to a place of being a counselor or a therapist in some form of shape?
Oh, definitely. So as a nurse, you are all of that. You are a caseworker, you are a social worker, you are a provider, you are everything. But the most important piece as a professional is being able to listen and understand and get the person's story. Because if you come in and I say, oh, you come in with a headache, I'm gonna give you this and this. I don't know. I need to know what is the history behind this headache.
Right.
Maybe there's something they are missing. And that's what we as professionals, as nurses, as doctors, as professors, we want to make sure that we are listening to people's story. And then we can better care of them.
So now let's bring this to the context of Uganda, because your expertise, your practice is in the United States.
Right.
And even what we watch in the movies, we really see that. Jokes aside though, but we really see that the healthcare system there is very improved. Everyone is involved in someone's healing, in a patient's healing.
Right.
When it comes to Uganda, it's rather different. Our healthcare system is still struggling, and it's very expensive. Accessing healthcare in Uganda is very, very expensive. Many of the corporates you see are accessing it through insurance. But then there's the underdeveloped areas that are not working in corporate spaces. They are not accessing insurance. There's free hospital services, but the standard still is lacking. How do you see what your expertise is in for Uganda?
Yes, thank you for that. So I grew up in a village in Nkuke. I have to say, you know, we didn't have much.
Right.
But I was granted an opportunity to go to the United States. I started in Nkuke Primary School. I finished my primary at Chimanya Primary School. I finished my A-level at St. Teresa, Uganda. And then I went to US. And also my mother is a local midwife. So she was greatly involved in helping those young expecting mothers. So I saw what she had to go through. With some people, you know, we didn't, there wasn't a place where they can go for privacy. Some people are not able to make it to the hospital, which is Lago Hospital, the government hospital. So as I was getting my education, you know, empowering myself, I had to keep in mind of where I come from. Even though I was in a place where I felt I had everything I needed, but I had to think about where I come from. So 4 years ago, I started doing some research to figure out what can we bring back, and health became one of my priorities. And I thought if we have a medical center in this area that is a nonprofit organization where people can easily access care. They don't have to walk too far. Mothers don't have to give birth on the side of the road, or sometimes, losing their lives, both the mother and the baby. So we started doing that work, and about a year ago, we started mobile clinics. And in those mobile clinics, we are seeing all kinds of people. And it was an eye-opener for all of us who are involved, because we're like, oh my goodness. Because we had somebody who came in one of those mobile clinics and had septic. They had an infection, they didn't know, they didn't go to the hospital, and we're like, you need to go now, otherwise you're gonna lose your leg. But so all those things are kind of empowering and humbling too as well. So that's how the Tebajukira Health and Empowerment Network started thinking about creating a medical center where people can easily access care. But also we want to make sure our focus, and all those people that work under me understand that people need to be treated with respect regardless of their background. Because our goal is to provide health care, and health is a necessity.
It is.
It is. So we want them to come to us and be able to tell us what is going on, and us respond respectfully by saying, we're gonna help you.
Right.
And also be honest with these people. If we are not able to, because we are not gonna have everything, especially at the beginning. We're gonna use, Mulago Hospital, we're gonna use Shtov Hospital, we're gonna use a lot of expertise, people who are actually in the community, who understand what is actually happening with some of these individuals. But the goal is to be able to provide that compassionate, being culturally sensitive, and also training our professionals that when somebody comes in, I know earlier you said, how people may be treated.
Yes.
Our professionals need to understand when somebody comes in, treat them like your grandmother, treat them like your mother, because they trusted you. They entrusted you and said, I'm gonna go to so-and-so. I'm gonna go to Tebajukira Medical Center because I know when I'm there, I feel like somebody cares.
Right.
And that's what we need. Mothers, when they come to us, sometimes they are desperate, sometimes they don't know. We need to make sure that we are comforting them. We also have cases, individuals who come in, they want to get tested for HIV. And I know this month, I think it's HIV month.
First December, really, yes.
Right. So HIV is a very sensitive topic. When somebody comes in, they get tested. We don't want to just tell them, oh, here are your results. We need to sit them down. We need to counsel them before we tell them the results. Because if you just tell them, you have killed all the hope they've had. And there are so many treatments out there now that having HIV doesn't mean you're gonna die tomorrow.
Yeah, true.
It doesn't mean that you're gonna end up with HIV, with the AIDS, because you're gonna get the treatment you need. So providing education and counseling so people can walk through that journey, knowing that somebody is there for them, is very, very important. All right,
and that is very profound. Please be part of the conversation. 0709 602592. It's the WhatsApp number that you're able to use and engage this conversation. We are looking at empowering the health sector of Uganda, and in studio with me is Dr. Brenda Namisango Shatok, the president of Tebajukira Health and Empowerment Network. Now, Dr. Namisango, you've talked about, of course, empowering the people, the community, with the, through Tebajukira. But I'm now thinking about the medical training sector altogether. that is empowering hospitals, doctors and nurses in hospitals, the big hospitals, the mulagos that we are talking about right from school. Is there a possibility that Tebajukira will engage in this line through the direction so that at the end of the day, the product of nurses and doctors in these major hospitals is one that has the seed of care, compassionate care to patients, as opposed to just it being a job?
Right. That's my hope.
Right.
And I envision that happening. And one of the reasons why I took this trip to come up this year, because I'm doing some feasible study related to bringing students at the university where I teach and come and integrate into our system by working with Mulago Hospital and stuff, as well as the local community health centers. So that's the primary work that I'm doing right now, and hope that within 2 years we'll be able to integrate. And Tebajukira Medical Center is going to be our center. And then when the students come in, they will be dispersed to different health centers. But I'm also hopeful. I'm in a conversation with the DHO, Masaka, and that's one of the topics that we want to discuss and see how we can move forward. Because I also think that having seen what it looks like outside Uganda and how we can make lives better here, we can also look at our training or education, like how can be competitive with the rest of the world. We might be, you know, a small country, but we can also be big outside in what we do. And healthcare is one of those areas that I feel like we can do more than what we are doing now.
Nice. You talked about, now on your screen, the picture that we've just seen, that was Dr. Namisango. Was that your graduation? Or tell us about the picture.
That's my
empowering picture.
That's my doctorate graduation. And that's one of my professors.
Amazing.
Yeah.
Now, you did tell us about midwives. Your mom alone was a local midwife. And in this day and age, in this Uganda today, they are still existing, yes, but they are not as encouraged as it was back then. Because many a times, because of the different health issues, doctors will always tell you, go to the hospital so that you deliver from a hospital. And the local midwives, the ones that are known as Mulerwas here in Uganda, are not exactly talked about as such. How best do you think they should be empowered? Do you think they're still important in this day and age?
I do. I honestly think they are very important. And I'm going to specifically speak for the midwives from Kuke, because my mother is one of them. She's retired now. She's not doing it as much, so hence
makes sense, yes.
I'm taking over. But they work really hard. They do their best. So with the Tebajukira Medical Center and having a labor and delivery unit, we are working with the local midwives to help them, educate them on modern professional delivery techniques or trainings. So because they do not have the, that level of education, to be qualified as a certification for midwife, what we're gonna do, we're gonna provide a training that is specifically in US is called doula, and that training, that person is there to provide comfort to the expecting mother, right? So they come in before the provider is busy. They've done, let's say we've done the vital signs, we've done this, we've done the scan, we see the baby is doing well. There's no distress. So the providers are still busy, nurses are still busy. The doula will be there by the mother's side to ask them questions, ask them what they like, what do they do, what are their plans, so that they feel comfortable, and when time comes, they will still be there by their side. And because those are the people they know. People in the village, they see me, they know where I come from. But when I'm in that setting, for example, I'm totally different person. They are gonna see me as somebody who is a doctor, who is a nurse. But then the doula will be there, like part of the family.
Right.
Yeah.
And I think if you say that, I can't imagine someone I've known, a local midwife maybe, but in that moment in time, she's the one holding my hand.
Right.
It's rather comforting.
Oh, it is. I tell you, it's the best thing.
Yes, every mother deserves a doula by their side during delivery. If you ask me, I'm convinced. I'm definitely buying into this. Hello, good morning, Uganda. Thank you so much. Thanks to Doctor. That's a good initiative. When someone wants to join Tebajukira, what is the criteria? Is it an NGO? Can branches be opened in Gulu? This is Robin. Thank you, Robin, for getting in touch. Please speak into this.
So we have a website, tebajukirahealth.gov. This is a non-profit organization. The medication right now, the medical center is under construction. We are hoping that we'll be starting operations end of December or January. We are finishing, we're making some touches. But yeah, that would be really good to open another branch in Gulu. But this is a non-profit organization.
Right.
And most of the funding right now are within the small circle. But we are hoping that once we get established and get more support, and starting to look at what are the needs of those individuals, underserved communities. We are very happy to expand the services.
Lovely. So is there information on how to get in touch on the website as
There
well?
is a phone number and an email address.
Right. Hello, broadcast. Can this branch also be offered to Lera? This is Moses Ongoma in Lera. It looks like more branches are calling you.
Yeah.
But one step at a time. Now, let's look at the healthcare in Uganda in your perspective. How do you think healthcare should be improved or empowered in Uganda?
That's a really good question and also very powerful. In May or end of April, we lost our father.
I'm sorry.
He struggled with a lot of health issues, and I was like, we're gonna do everything. He was sent to different hospitals, good hospitals, because honestly we were able to afford it.
Right.
But then it was an eye-opening for us, especially for me, because I was like, if my father is able to get all this treatment we have a need, and we still struggled in getting some of, like, as simple as getting a catheter, fully catheter kit. You have to go from one place to another place, one pharmacy to another pharmacy, and you don't know how stale those things are. So to me, that was like, oh my goodness, we need to do something. So I imagined bringing these kind of services to local areas, to communities, and be able to say, okay, when I go to Tebajukira Medical Center, I need to get I'm having trouble with my bladder. We need a fully catheter. The whole kit is going to be there.
Available, yes.
You do not have to go from different pharmacies. Everything will be there. The nurses will be trained on how to use some of these equipment. Expecting mothers, when they come to us, we're going to have everything there. And as we expand, we are planning to put more services and bring in more equipment.
Right.
But because this is a non-profit organization, we also have to heavily depend on our friends who are willing to join hands to make this a big impact, not only in Kuke, but also like the rest of Uganda.
Yes,
Yeah.
very well. Thank you. This conversation has to definitely come to its close, but I'm empowered and I've been given hope. I don't know about you, but I think this is hope. This is hope, and it's a point to say thank you.
Thank you very much, and I would like to extend my gratitude to the body members. Obviously, I'm not in the country, but I have people who have been here and working it tirelessly and being honest. So I'm very grateful for all the board members. I'm grateful for my family, but most importantly, the people of Unkuke, because they've entrusted in us. They believe in the work we are doing, and we want to give back.
Right.
And we're going to make this a better place.
Indeed,
Yeah.
indeed,
Yeah.
indeed. I will just echo again and say thank you to you and the whole team. This gives hope. And follow the website of Tebajukira Health and Empowerment Network if you want to be a volunteer, if you want to be part of the great work that is being done, if you want to get a contact, every detail is on there. Let's make Uganda a better place together, one by one. Thank you so much for being on the show and for sharing your opinions and comments. Now, as is a Friday, some people to be celebrated. As we close this off, I want to give a few birthday shout-outs. One to my brother, Joel Paul Waluya. Man, I'm so proud of that man. I'm so proud of the man that he's become thanks to our mother. He has such an amazing family. He's such a gentleman. He's such a perfect, present, available dad. So kind to his spouse. I'm just so proud of you, Joel, and I want to wish you a happy birthday, and I love you so much. That is my brother. I'm just so proud of him, and I love him a lot. Love him a lot. He's just thumb. But the other birthday shout-outs that we do have, happiest birthday to Pauline, a journalist student. Blessings and achievements in your new age. This is from one of our colleagues here at Good Morning Uganda, and that is Christopher Mulondo. Happy birthday, Joanne. And happy birthday to everyone who's celebrating their birthday in November and on this particular day as well. Joanne is coming back with an artist, so Good Morning Uganda still continues. Stay tuned. Good morning.
Exercise can't be sustained. Eating can't be stopped. It's even hard